Hello and welcome back to Dental TV, now on YouTube. And don't forget to hit the subscribe button to get insights from experts. Today we have a special expert here online, wherever you are watching and listening to us. It's Florin Cofar from Romania. I had several discussions with people, colleagues from Eastern Europe, and I asked them, why are you pushing hard education, dentistry? And the answer was, and I think, Florin, you agree, we are still hungry. We see in the European culture a little bit laziness. We think we have everything, we can everything. And I experienced that when I was a student in the 1980s in Zurich at dental school. We had Professor Scherer, we had Professor Lutz, we had Professor Stöckli, we had Strub, Belzer, all these guys who were at the university, and we learned so much from them, and we felt their energy to push dentistry forward. And this energy, this fast forward thinking has been a little bit lost. And I'm happy that people like you, Florin, are pushing us to explore new limits. It's like a little bit Star Trek. Go where no dentist has gone before. So, Florin, maybe you introduce yourself to the audience before we jump into a lot of interesting things we can talk about.
So, to go with your introduction, my name is Florin Cofar. I'm a dentist from Eastern Europe, Romania specifically. And like you said, I think with the East and West, I think it's a life cycle issue, more or less means that there's always been a delay, which we all have to know and culturally accept. Like the West has been always ahead in many things and still is. And somehow I think the appetite that you're talking about now that we see in the East is pretty much exactly like you said, is what you experienced probably maybe 15, 20 years ago in the West. And it's just maybe also related to what is happening in the market. In the West, there's a shortage of dentists. In the East, I think we have plenty still. It's just statistics.
But let's say it depends where you are. For example, in Switzerland, we don't have a shortage. For example, Zurich has 1,400 dentists for 400,000 people. So we have too many dentists. It depends where you are based. And we feel in Switzerland, that's the first country where the number of implants is going down. So we see and we feel the impact of prevention that started in the 1960s is
Yeah.
taking over. So I see more and more young patients and patients also at 30, 40 years old with no cavities, with nothing. So what can you do? So it's not I was in Dubai and I was asking one of these VIP dentists, do you have a dental hygienist? No, we don't. Because we have so much caries, we have so much periodontitis, so I felt like 40, 50 years back in Switzerland, where we really had to drill and fill. And now we are
Yeah.
more into prevention. But you were talking about ahead and behind. You were really ahead of your time when you started exploring digital dentistry. So I remember reading, hearing, watching a lot of content that you were mentioning, that we need to use more digital tools at a time where, let's say, the elite of dentists were still a little bit skeptic towards digital dentistry. What was the initial or the idea to really jump into digital technologies in a time where, especially, let's say, in Eastern European countries, I think analog dentistry was 99%.
Well, I think first of all, on a personal level, I've always had a background with technology. Now, don't think in a very professional way. I just, I've always been around the computer, so to speak. And I see technology as an enabler. I always saw it as an enabler. And of course, when you're young and hungry, you try to play your strong points. And pretty much, I think the easiest way always the best place to look for innovation is where different disciplines or different areas overlap, even if slightly. It's usually at the connection between two fields where it's going to be the easiest place to find innovation. Yeah, that's
So, but what was the motivation? So basically, what drove you to say, okay, now we need to find ways to improve dentistry or to connect? You mentioned it, connect the disciplines to become more efficient. I think this was
yeah.
the driver behind your ideas, or what?
Yeah, this, I mean, conceptually it was this, but on a personal level, there was a singular event and a very special person that sparked it for me. It's his name is Paulo Cano, and he's not as famous as he deserves, I think. And I believe around 2012, when I met him, for me, I experienced the first meaningful use of not the first meaningful use, but the real meaningful use, a real disrupting vision about using CAD/CAM at the time. And that was just like a switch flip moment. And from that, things just one led to the other. But I think we all have in our professional life, whether we realize it or not, we have some people that just, come by and without probably even intentional, they enable something inside our minds. And that was Paolo for me.
So this was like the ignition or
Yes.
the first thing to start Smile Cloud, or what? When did you came up? Because today everybody's talking about, or everybody, a lot of people are
Yeah.
talking about Smile Cloud. We have cloud solutions from all the big companies. Everybody wants to go into the cloud. But when did you start? I remember that you started talking about or having the idea of Smile Cloud before cloud computing was even invented.
Yeah. Well, so pretty much there's two fundamental areas and two fundamental, let's say, directions in Smile Cloud. The first one, when we talk about cloud and just these basic things that today are normal, like having the data in the cloud, having a centralized collaboration system of that, we got this to market in an early access in 2016. Just to give you context back then and how we got to this. Before that, I realized, just like you, that we need to document. Okay, this was the first important conclusion for me as a young dentist, that documentation must be part of the DNA of what I do. And then I tried to standardize this at the level of the clinic that I was working in. So I only worried in the initial phase of how do I get the data and where do I put it. And at the time, there was, you had to have a local server, you had to have a certain infrastructure to put all the things there. And this part, ironically, was very easy. But the thing that I didn't anticipate back then was that if you simply put things in a place, nobody will ever revisit them. So we did document, but we were not making any use with that. So then we had to think, okay, people need it in their pocket. You need it in real time. You need it all the time because otherwise it's not going to work. And that's basically when we started. And at that time, of course, we had Dropbox and other things, but for me, Dropbox was never optimal enough for what we needed, pretty much.
Basically, also Dropbox, you have to be careful with using Dropbox, Google Drive, and all this for data safety regulations. So this is also an issue. I know
Yeah.
that in the professional versions of Dropbox and Google Drive, they're so-called HIPAA compliant, that they fulfill the especially the European data safety regulation that are very strict. But at the end, I always say, look, I don't know who's really interested in teeth and radiographs where you don't recognize patients. It's a little bit different if you share faces and other stuff where you can see who's on the image. So basically, what was then the next step after Dropbox?
So let's say that this initial layer was all about, the baseline, having the infrastructure, the data, the ability to work with people and to communicate. But of course, this was never, something, it was just too generic to go and just, you know, sell, so to speak. It's just, you know, not something that is sexy enough. But then it was a convergence with the Paulo story. Okay, where for the ones that do not know, Paulo was for me one of the first ones who really pushed the idea of using libraries of natural teeth and all of that. I mean, libraries were not new. There were many libraries at that time, but usually it was like, yeah, usually it wasn't about just natural dentition. And then we basically build the second layer. The second layer, it's just the ability to first of all to stack data to create all of this more complex data contexts, and then having a philosophy of design built around this natural libraries. Pretty much that was the second layer. That in the beginning it was more conceptual than real because we didn't have the technology in the first years, but we stayed stubborn to it, and I believe right now we're at the point where this is much more of a reality than in the beginning. It was a dream. Okay, it was just a vision, and people that actually subscribed to SmileCloud in the early days, I really respect, because they pretty much funded the dream by just believing in it, even if technologically speaking things were not there for a long time actually.
I remember that for 2, 3, 4 years it was like going, but not
Yeah,
really, not really taking off.
yeah.
But what was then the collaboration, or who jumped in, or what happened that it really took off? Was it the general hype around cloud services, or what was the reason? Because you know that the first really cloud-based big thing was Align
Yeah,
with their tools, and they are still, I think, the biggest cloud
they are. Yeah,
service in the world. And then other jumped on, like all the big companies like Dentsply Sirona with the concept, and a lot of different things. Ralph Georg with his Smile 5, and you name it, Christian Coachman. So there's a large number of people, of dentists, that were thinking, okay, we need to collect the information, create what we today call the digital patient, and then from there go and do the diagnosis, the treatment planning, and help dentists and lab technicians to realize, to manufacture the restorations or whatever we want to do with the patient. It's not always restoration. Sometimes it's just planning and do ortho treatments. I think SmileCloud has also the philosophy of not just being a mechanical thing, but being a little bit more. So what was then the next step of this evolution?
I think if I am to look back, probably, you know we are a company that never spent money in marketing. Actually, the only thing we did is we enabled education for everybody that was interested to do it. So this was, I think, healthy but slow. Of course, it was. You have to accept the reality that that is the price you're gonna pay. However, there was eventually a critical mass that of people that start to to see the potential there. Because what was the problem in the beginning? You had all these broken links. So your customer was only the one that had enough know-how and enough vision to bridge the missing links, which was a very limited niche of the market. So two things happened simultaneously. One, we were able slowly to capture more of these people, and at the same time, we started to fill in the gaps to you know fill in this link. So I don't think there was a singular event. It was these two trends that eventually converged. Of course, there was also the moment when Straumann came in, which was a big, I think, also validation from the market, and it was a big learning game for us as well. There's a lot that we have learned with Straumann and still are learning. So it was these two trends, and then we start to get validation, and then at a certain point things start to accelerate.
So the latest thing, and this is going viral on social media, is the integration of AI tools to visualize patients. So basically, you are using tools that are also available on other platforms, that you take a static image of a patient and make the patient speak, smile, interact, get emotions, to visualize how a patient could look like. So tell me more a little bit about was this a project that was initiated together with Straumann, or when did you start integrating more AI tools also in the software?
So we're always closely linked to Straumann, of course. This project was something that we had in mind for a long, long time. And before I tell you, some of the AI specifics, which anyways, I will keep it broad because it's not the point, but the real need for this is actually for so long. The problem is that, of course, you need a mock-up at the beginning of the process. This we know, okay? And for the last decade, the problem is that all the industry tends to do additive designs so they can do a mock-up, which means we end up as a market to have a lot of either over contour prosthetics, which we see even today a lot. Either you have a rather confusing workflow or counterintuitive that you basically have to do the design two times. You do it one time just to be able to create a mock-up, and you do it a second time to simply, you know, have the clinical depth that is required for a mock-up. And I believe that basically the Yes update is positioned against the motivational mockup. This is the one that we want to pretty much, which motivational mockup is a communication tool. We have to understand very clearly what it does. And I think we finally have something that beats it I would say all aspects, yeah, because it's efficient. It's in when it comes to the real use case, which is communication. I think it's a much better tool. As for the actual technology, there's a lot of AI systems and a lot of things available everywhere. I believe the real innovation that we actually brought is a real contained, a real controlled use of AI. It's not, a one size fits all that you click a button and then you have some generative model that just does something that you cannot, control. But rather, I feel that we are, first of all, preserving the design in this, preserving the mimics, preserving the expressions. And yeah, I think it's rather a sweet spot of how we, let's say, manage the technology to do this.
So did this integration of new AI tool also get you a lot of new clients on the platform?
Well, it's early to say. Of course, we can see the hype, but yeah, we can see, we can obviously see a bump, but I think it was 2, 3 weeks ago when we actually released it. So I like to stay pragmatic and grounded and not,
Yeah, yeah,
yeah,
you're right.
let's
Because
see.
yeah, yeah, because we talked about in the introduction before we started recording that dentists are sometimes not so easy to reach. A lot of dentists. I have like a statement that I developed when I started my project. I don't talk to dentists over 40 anymore because they are like very, very narrow-minded. They say, well, everything is working, I have my business, I'm happy or I'm not happy, whatever, but they are not really open to innovations. So how do you see this market or this feeling of dentists? Are younger dentists open to new technologies more than the older generation? Or what are your thoughts on this change in our profession, that is we should open up a little bit more, accept new technologies? What are your thoughts on this?
Well, first of all, I'll take as a compliment since I'm 43, so I'm in the second category. But yeah, I think, you know, it's a question of mental plasticity at the end of the day. And I think as we grow older, of course, how mentally plastic we are, how adaptable we are to change, unfortunately decreases. It's something that we need to understand and accept. But overall, I think that, of course, the younger ones will tend to accept even, going through pain, if you will, to get change done. And then the more comfortable ones, the only alternative you have to get them to adopt things is to make it easier for them. Just making it better, it will not do it. Just because there's a better potential, it's not enough. Usually, it's, in my experience of clinical reality, it's the simple things that thrive. It's the simple things that survive. The complicated things, not necessarily, even if they're good. Why? Because you have this huge bottleneck that you mentioned.
It's
People
like
are
it's
people
like this
after.
like the story when Dentsply Sirona, or that time it was Sirona, wanted to push CEREC in the American market. They invented the green arrow strategy. So the software was proposing something, and they told the American doctors, just hit, if it's green, just hit and go to the next step, and don't think too much if it's good or bad, and then just, go ahead. And this simplification brought a lot of new clients, but a lot of people
Yes,
then say, yeah, I followed your strategy of just click, 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 and the result was not fitting. It was so there came new issues. But the idea, I agree with you that we need to simplify things, but not sacrificing too much the quality of our work. So this is it's not so easy. It's not so easy to do because
no,
as we mentioned before, dentists love if you tell a dentist, okay, I have a new idea for you, Florin. I know how you can make more money. Then dentists start listening to you. and, and if you say, look, I have a new idea that you can become a much, much better dentist, it's, yeah, the motivated ones, they would say, yes, I want to become a better dentist because then the rest will come automatically. If you're good in what you're doing and you can communicate with your patients, the economical part will follow automatically. But the laziness drives a lot of people to find the easy way around. And so, what are you
yeah.
saying to this to these colleagues?
Well, first of all, I think there is an approach to deal with this, and especially when we talk about AI, for example. And I believe that, if you look at any process, AI pretty much stands for automation. And in my opinion, we should automate everything except decision, because decision equals ownership, equals responsibility, which are things that I think every professional should have. I think it's also a moral question that, although we can automate all the way, I really believe that probably it's not the best design for this. I really believe that we should automate all the way to give a good draft always for decision, provide the context, all these things, but not replace decision. And I think this is how we solve this paradox. And for the ones that don't even care about decision, honestly, I do not have an answer. It's many times frustrating for me as well. I can feel it also in you, that conceptually we both deal with the same dilemma. Yeah, it is what it is.
So, because this was the next question I wanted to ask you, but you
Yeah.
gave me the answer. How to improve the decision making process and not make it only money driven, but also or more patient driven. So for me, the future of dentistry, and you see it, we have different cultures in different parts of the world. And I told you in Switzerland, prevention is really taking effect on our profession, but after more than 60 years. So it takes a long way, it takes a long time that a society accepts changes within them, because I still see the number one barrier for patients to accept prevention is because they accept they expect treatment. If a patient comes to a doctor or to a dentist, he wants that something happens. And if you just explain to the patient, look, you don't clean your teeth, you should change your diet, you should do this, you should do that to become a healthier person, they're like, and
Yeah.
now, so what is the
I
next thing? So what is your vision? Because I ask this all my all colleagues I'm doing interviews. What is your vision for the future of dentistry? Because I had an interesting interview also with Ron Jung, and he was talking to me about his new project of robotics. So they say, okay, we have a new project. It's with the ETH, with Basel, I think also ACTA. And so different universities are collaborating on, you plan the whole treatment of a patient, and then the restorations and everything is fabricated before you even start prepping the teeth. And then a robot system is doing all the work inside the mouth, and then you just can place the restoration. And my comment was then, why are you not working on a small robot that you put in your child's mouth when the child is 5 years old or 4 years old? You put a small, tiny robot inside the mouth and tell the robot, take care that little Florin is never having an issue in his mouth in the future. So what is your concept? Because the one from Ronnie is a very mechanical concept. So still relying on, yeah, we need to place implants, we need to place crowns and veneers. So a mechanical approach to treat patients rather than a preventive approach where you say, okay, I give you a tool, a small little helper that will prevent you to see the dentist.
Yeah. Well, before I answer this question, I just want to make a comment on the prevention side because ironically, this was just on my mind. I just came last night from a lecture with Eric in for a group in Germany. And I was even after the course, I was with one of the guys there taking a hike in the nice landscape and talking about prevention and talking about how you manage to change this culture because I'm I see the challenge. Okay, that there's like a you need a cultural change. This is the hardest thing to do. And what is funny is that we have issues here in my part of the world to get people, to come in, to get people to explain that you need a certain education for, cleaning and all of that, that you potentially just have to waste one appointment just to understand how to clean and these things. On the same time, you see in the market, also here, you see there is a culture increasing for anti-aging, for lifestyle optimization, for fitness, for these things. So, in my opinion, we have to, in order to get this culture shift, I'm still wrapping my brain around how do I get the link between the two? How do I get the basically to for the people to make the connection between oral health and everything that is in terms of longevity, because oral health directly translates into longevity, but because we don't have, direct markers like, VOMAX or, the basics like heart rate and stuff that people have on all their wearables. I guess it's just the not easy. Okay. Now, to tell you also, my answer is twofold. So for prevention, I think we need to be able to solve this equation in how to get a much more simplified way for the patient to understand that oral health is longevity without sounding that us as dentists we make it more important than it is, because that's how I feel when I talk about it in my part of the world. I feel that, yeah, it's dentistry. So that's in terms of prevention. I think on the dentistry side, what I can see happening is the lab switching to additive. So more or less, it's only bottlenecked by materials, which I think it's gonna be solved rather sooner than later. So what I see is a lot of the CAD cams, I think, a lot of the milling machines actually will be slowly, not slowly, but rather fast replaced with print solutions. Not yet, Okay, but I think this is going to be the direction. And of course, all that technology will not disappear. And I think it's very likely that Ronnie is right, and all that technology will eventually convert into some iteration of robotics or assisted robotics or similar things. But generally, yeah, this I think will be the trend. Software will get friendlier, will inevitably mature. We are a very mature market in terms of software compared to other markets, even, because it's just we live in a hardware driven industry. Dentistry is hardware driven. And yeah, these are pretty much the directions that I can see, that I think will happen, of course.
So, but you mentioned a good point that I think we should work on jumping on and partner with these doctors, because a lot of people always say dentists are not doctors. I don't see that,
Yeah.
because we are doctors for the not only oral cavity. So, but let's not enter into that discussion. I see dentists are doctors as other doctors are, but we should really try to collaborate and jump on this longevity thing. And I have a colleague of mine, Georg Reichert from Stuttgart. He had a nice presentation a few weeks ago with the group that I'm a member of, Neue Gruppe, and he was talking about how he approaches exactly this with his patients. So when a patient comes in, he says, "Look, Florin, you're 43 years old. Your body is 43 years old. Now let's check your mouth." And he shows then the patient a timeline, say, "Okay, Florin, you will reach around 82, 83 years.
Smart.
So you have 40 years to live. So this is your longevity. This is your lifespan. You are at 43. I checked your mouth and your mouth is already at 65."
Yeah.
And
Smart.
then the patient maybe realized, and then you tell the patient, okay, if your teeth, you are at 43, your teeth or your mouth is at 65. If we're talking about erosions, abrasions, whatever problems, tooth loss, periodontitis, and so on. So if you want that when you reach 65, your teeth are not already gone because they are older than your lifespan, we need to act. We need to do something. And he told us this makes his patient think. And they are ready. Then he says, "Look, now to close this gap, to close the gap that you have between your physical age, your body age, and your mouth age, your oral age, we need to do something." And then I think the patient accepts treatments, accepts to see the dental hygienist, to get into more checks, to learn how to improve. It's like then you then are the fitness coach, the oral fitness coach of your patient. And I think this would be, for me, this would be a nice thing in the future, to become a fitness coach of my patients, helping them to become oral fit, you know?
Yeah. No, I completely agree. Unfortunately, as you know very well, we have to also try to somehow tackle this, let's say, capitalist wave of telling that implants are equal to teeth and all these other things. That, I mean, the education must be in a sense of, yeah, prevention and valuing the what the patients have, right? But it's just so easy to go down the other slope, which is whatever we can manage anything in a day, we can replace, we can do, we can da da, because there's the economic drive on the other side. I think inevitably here will be cycles as well. So at a certain point there will be a shift. Whether or not we can impact this shift, I would love to be able to play a part in shifting this mindset, but I think with or without me, at a certain point, the shift has to happen. Has to happen. It's just, I think, inevitable. I don't know though if it's going to be a couple of years or more or much more. This I don't know.
That's also the society and the health authorities in the countries that need to also work on this. it's how they treat, how the healthcare systems are treating dentistry as a part of the overall health, or if it's just treated as something that is, yeah, everybody hates the dentist. So the dentists still have, if you check the movies, check the media, check everything, dentists don't have a positive image. You know what I mean? So basically we need to work. There's so many things to work on to get, if you I'm sure if you ask a politician, if you just throw the word dentist to somebody and tell me what is your first thought if I tell you the word dentist, and a lot of patients then say pain, uncomfortable, I don't like to go there, blah 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 blah. So more negative feelings, more negative words than positive words, and I think this is also something that has to come from outside our community to work on towards a more positive image in the public of our profession. I don't know if you agree also on that.
Yeah. I asked my daughter one day, so what do you want to be when you grow up? And she said, Daddy, I want to be a doctor. And I said, great, a dentist. I said, no, 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 a real doctor. So, yeah, culturally, I think that people want to minimize the time that they spend with the dentist. And that is linked to our whole conversation. If we can somehow make it more enjoyable and in the parts that lead to treatment, maybe we have a chance to change something, and we should in time focus on that more. And I don't have the solution here yet, like you pinned it very well, especially in my context, which is not Switzerland. It is the Balkans. It's rather different. But yeah, I think, and also because, like you said, regarding on authorities and all of that, I have so little hope in that. I only want to focus on what I can do. If we are to wait for, this is not something that at least culturally we can expect change from, not here. Yeah, change has to come from people like me, like you. I mean, in my part of the world, don't don't wait for the
Just
politics to solve
just
anything.
just a final remark.
Yeah,
Can you ask your daughter why she doesn't want to become a dentist?
yeah. Well,
Maybe you have
I
to
will
ask
one day. Yeah,
her the
yeah,
question, and because she obviously has an image or an
yeah.
idea, a vision what the dentist looks like or what the dentist is supposed to do. And I still think that she already feels that the dentist is somebody who hurts people and the doctor is somebody who helps people. So basically, you know what I mean. So
Yeah.
this is a cultural shift. This is an image that we need to work on. That dentists are not. We are.
You know what?
It's like I had a patient, and she was telling me I'm afraid of the needle, of the injection, and then I was like saying relax. I was putting the needle in, and then I started laughing, and I told her, "Do you think dentists are sadistic person?" And she was laughing. That I said, "Please don't stop laughing because I'm still with the needle in your mouth." Then I took it out, and then I told her, "But this is a serious question. Can you answer me this question?" I was saying, "I don't know." Say, look, a sadistic person likes if you feel pain, and so like doing the restoration without the anesthesia and always asking the patient, "Do you still feel pain?" And if the patient says yes, then you say, "Ah, good." You know what I mean?
Yeah,
So
yeah.
basically, dentists are not sadistic people, and we want to help our patients. But this should be something. This message should be transported out to the patient community more often. And yes, but,
As
you're
a
you're right.
as a last piece, I know the answer to her comparison. And the thing is, even for a child, the way that culturally is perceived, that a doctor is somebody who saves lives. Okay? When a kid tells you that I want to be a doctor, it means I want to save lives and I want to help other people. And that again is back to our original problem, because dentistry is not seen, is not perceived as being, a strong connection to that. I mean, people say, hey, you can live with or without a premolar, right? It's,
Hmm.
that's how it is perceived. Because again, there is no direct connection culturally in people's mind between oral health and longevity. And whenever we solve this problem, I think a lot of also these perception issues will be solved.
That's a great final word. Thank you very much for taking your time, for your insights into Smile Cloud and your ideas, your philosophy. I'm looking forward. I'm watching you, and maybe we can talk again
Likewise.
in 1 or 2 years about where we are heading to, where AI is bringing us, where dentistry is heading to. Thanks again for your time. Wishing you a happy summer. And people out there, don't forget to subscribe to our channel to see more interviews, not only with people like Florin, a very inspirational person for the dental community. Thanks for all your inputs and all you're doing. So keep up the great work. And yes, wishing you a
Thank you,
great
and
summer.
likewise, Alessandro. Thank you.
Thank you.
Thank you.
Take care.
Bye.